I'm going to talk about the testing. There is a lot of cloud and mist regarding who should get tested, when should the testing be done, and how accurate is this testing. So let us try to clear this cloud first. So who should get tested? Now, in United States, we have some of the principles out here that have been put out there by the CDC. People who have signs and symptoms of COVID-19, they are definitely tested for the COVID-19 virus. What about people who do not have symptoms, but they are exposed to somebody who has symptoms? For example, if it's the husband who is admitted in the hospital, but before being admitted in the hospital for COVID 19, he came in contact with his wife, with his son, with his family. So, all these people could be asymptomatic as of now. So, all these people need to be tested for COVID 19 virus. Also, in US, people who actually are going for any procedures in the hospital currently, like any emergency procedure, surgical procedure, office procedure, everybody is tested for COVID-19. So when should the testing be done? I know this slide which I have put here is a very complex slide, but let's make it simple. I want you all to concentrate on these two graphs. One of them is this red graph. This red graph is the viral load in the lungs after infection with COVID 19. And the blue graph is the accuracy of detection of virus by testing. So suppose if anyone gets an infection today, say on 25th of July, it will take almost a week to have the symptoms and also the viral load to reach to its peak. So if you do testing during this period, suppose if you do testing on day 2 or third day or fourth day, only 20% of those tests are going to come positive. But as the days goes by, the viral load increases and the accuracy of testing also increases. So when patients develop symptoms, the accuracy of testing is greater than 99%. Now, like I told you before, once the virus enters into the body, our body's defense mechanism kicks in. It starts fighting against the virus by producing these viral fighting proteins, which are called as antibodies. So I'm showing you these dotted lines here. These are the antibodies, and these antibodies start appearing in your body almost 10 to 14 days after the infection. And these antibodies, they play a vital role in the plasma therapy, which is currently offered for patients infected with COVID-19. So when COVID-19 came into US, like it came in US in February of this year. And there was a lot of outcry in US regarding testing. Like there is not enough testing, we don't have enough kits for testing, and there was a lot of chaos around. So to answer that, various companies started producing this various platforms by which they could detect the COVID-19 virus. And the most popular one was the Abbott testing platform. I'm going to enumerate just a few of these testing platforms, but trust me, there are more than 100 platforms right now here. So this Abbott testing platform became popular because it could be done in the outpatient settings, and it took only 5 minutes for the test to be positive. The negative result took 13 minutes. Here on the right hand side, this is just an Abbott platform. It's a very portable instrument. This is a cartridge, and here they load the sample. The sample is obtained either from the nose or the throat. And once the cartridge is loaded into this machine, you get the result in literally 5 minutes. And if anyone out there, any microbiologist, this is what I want to show. This is how the viral RNA looks like in the PCR. The other platform, which is currently being used in all the acute care facilities in the hospitals where there are high volume of cases, is the Cepheid Gene Expert machine. The viral detection takes 30 minutes, but you can load multiple samples at one time. So you can get results for many patients in within half an hour. There's another platform called QIAstat DX Analyzer. This platform is also very comprehensive. It detects not only the coronavirus but all other flu viruses. And like I said before, there are many, many more platforms. Till date, in US, 51 million tests have been performed, and the percent positivity rate is 10%. So, what about antibodies? So, antibody testing, this decision is currently made over here by either the state, the local health authorities, or your healthcare provider, meaning your doctor can actually order an antibody testing for you. So, how do you interpret that result? If I have a positive antibody, that means that I had a COVID 19 infection and I recovered from it. But will I be protected again from reinfection? We do not know that answer as of now. We cannot say with certainty that if a patient has developed antibody, that means he will not get reinfected. What if my test is negative? If my test is negative, probably I never had a COVID infection, or I did have a COVID infection, but I did not produce any antibodies. So, in either of these scenarios, you have to take steps to protect yourself, follow the WHO guidelines, and protect others. So, I consider myself really fortunate to be involved in the care of COVID 19 patients as being part of a world's largest COVID plasma program. This program has been established here in USA in March 2020, and this was an initiative from the US FDA that collaborated with the American Red Cross Society at the National Blood Banking Committee, and it formed this big international project which is currently running 24/7. It's called as the COVID-19 National Expanded Access Program. The goal of this program is to provide convalescent plasma to people who are currently infected with COVID-19. And till date, more than 2,600 hospitals have participated, and there are more than 11,000 physicians who are working as principal investigators, and I'm one of them for my hospital. So, what is convalescent plasma? You might be thinking. Convalescent plasma is actually plasma obtained from blood of patients who are infected and recovered from COVID 19. So, this is just a simple diagrammatic figure to show you how this plasma is obtained. Here on the left hand side, you have a red blood bag, and on the right hand side, there is this plasma bag. So the plasma is obtained from the whole blood by a technique called centrifugation. The plasma can be stored for almost a year, so it has a very long life, and it can be stored at 1 to 5 degrees Celsius in a freezer. Convalescent plasma therapy has been used in previous pandemics, such as polio, measles, Ebola in the past, and it has shown some effectiveness. That's why this therapy has currently been come into practice. So, who can donate plasma for COVID? People who are currently infected with COVID 19 and have fully recovered from it. Those are the people who can donate their plasma. Currently in US, these patients, they fill out an online form and they go to the American Red Cross Society to donate their plasma. So who are these people who should be given plasma? So as Dr. Rakhi Krishnan mentioned, like patients who are severely ill, admitted in the hospital, who are actually not responding to medical line of therapy, and who are really very sick, these are those patients who are eligible to receive plasma. And once these patients are being detected, a COVID plasma request is being made. And in this pandemic, every hospital has come up with some approach on how to deal with when a COVID plasma request is being made. In my hospital, we get a consent from the patient or the patient's relative. And then the patient is enrolled into this national COVID 19 National Expanded Access Program. Once the patient is enrolled, he receives a specific code, which is called as the EAP code. This EAP code is very important because this helps us track these patients after they receive plasma to see what happened with them. How are they doing? Did they have any adverse problems? Did their symptoms improve? Were they discharged from the hospital? So that is being done. Till date, we have more than 69,000 patients who have been enrolled in this program, and more than 43,000 patients have been infused plasma. So when the plasma is being given, it's a very simple process. It's a bedside procedure, and it is done under, you have to monitor. So it's pretty much monitored by either the nurse or the physician taking care of the patient. At one time, only 1 unit of plasma is given, and plasma is ABO blood group compatible, meaning if you are A positive, you will get an A positive plasma. If you're B negative, you get a B negative plasma. And as per all the rules and regulations, it is always tested negative for all other viruses. The dose of plasma depends upon the patient's weight, the height, the clinical condition. So when I consent patients for plasma, most of the patients come up with this question: is this plasma going to cause any side effect? So the answer to that is no. From the studies that has been done by this Mayo Clinic Expanded Access Program, they did an initial study on 10,000 patients, and they found that the adverse reaction rate is less than 1%. The other question that they commonly ask me is this plasma going to cure my COVID-19? I would say that is a very difficult answer, but if it is given in early in the course of the disease, it has shown some beneficial effects. There are some early studies done by the Expanded Access Program where they have shown that if you give plasma very early in the disease course, the hospital stay rate has reduced, the ventilator requirement rate has reduced. So still larger studies are being awaited, which need to establish the efficacy. But the COVID-19 national program is such an organized program that I am comfortable saying that it will definitely have an answer for all our questions. And so by this, I would like to say that we continue to work hard. There is always a light at the end of the tunnel. The tunnel is temporary. We just need to work hard and hang during this period together. There will be a day when we will not have to wear any masks. These lockdowns will end. People will start living a normal life. With this, thank you so much for your attention, and we both are happy to take any questions if you all have. Thank you.